Welcome everyone, and thank you for being with us this morning. We'll go ahead and get started. Thank you for your patience. I do want to give a couple minutes to Javier. We do have an interpreter that will go over some instructions if you wish to listen to this press conference in Spanish. Do we have Javier on? Javier, your floor is yours.
Yes, I am not in the interpretation channel.
Got it.
Go ahead and explain how the interpretation works, Javier.
Interpreter is not in the interpretation channel.
Okay.
Yeah, we want you to do it over the regular channel so that people that are on can know how to get to the interpretation channel.
It sounds like this feature is not available, so I'm going to go ahead and move on. We're going to go ahead and start it. I do apologize. We have been having some technical difficulties in getting our interpreter into the Spanish channel. So with that, I'm going to go ahead and get started the press conference. All right, so let's get started. Thank you, Javier. Let's get started. I want to thank everyone for being with us here this morning. My name is Veronica de Lara, and I'll be your MC for the event. Before I share a little bit about myself, I want to inform the media and the participants that you will have an ability to submit questions using, there should be a Q&A option on your Zoom platform. Feel free to direct your questions to any of the speakers, and we will be addressing the questions at the end to all of our speakers once they've all spoken. For the media and participants, if you wish to receive a copy of the press package, we have made the press package available online, and we will be providing an online link at the end of this press conference. We will also do a follow-up email with the link to the press package, so just stay tuned. The press kit will include our speakers' bios, our letters of the Department of Alcoholic Beverage Control, and ways to take action. And so with that, let's go ahead and get started. Thank you, everyone. Again, this is Veronica de Lara. I am a board member at Alcohol Justice, a project director at Pueblo y Salud, and I am the co-chair of the California Alcohol Policy Alliance. CAPA is a statewide alliance made up of over 40 organizations throughout the state of California, and we focus to protect the health and safety and prevent alcohol-related harms in our communities. We are all here today to speak up and uplift the voices of our communities against economic profit. There has been a lack of consideration of alcohol harms and misuse as a public health risk factor during COVID-19. Instead, under Government Newsom, the Department of Alcoholic Beverage Control has deregulated and temporarily suspended the enforcement of regulatory requirements on alcohol licenses in the state of California. Our state, being one of the highest in COVID cases reported, we still continue to prioritize economic recovery versus the health and well-being of our communities. Our communities of color continue to be disproportionately impacted. Our social, health, and economic conditions makes us even more vulnerable to substance use and contracting COVID-19. Why are the impacts of alcohol harms and misuse not considered in the statewide COVID-19 response? What is the science behind alcohol being essential during a global pandemic? Why are we deregulating alcohol? We want answers. Our communities and our families demand public health and safety over economic gain. With that, I want to go ahead and introduce our first speaker, who will speak on alcohol harms and the current rates of COVID-19 infections. We have Carson Benowitz Frederick, is a research manager at Alcohol Justice. He holds a Master's of Science in Public Health with a health communication emphasis for Johns Hopkins Bloomberg School of Public Health. He has over a decade of experience in health communication and education with a special in harm reduction, tobacco control, and alcohol control. Carson, the floor is yours.
Okay, thank you so much, Veronica. Again, we know that California is absolutely an epicenter of coronavirus, and we know that California has been engaged in methods of what we call regulatory relief, which is stripping away the public health policies that prevent alcohol harm and limit the access of the alcohol industry to consumers. So the 2020 coronavirus pandemic has created economic and social conditions that have no parallel in our lifetimes. It has made basic social and economic interactions a vector for a potentially lethal disease. In the United States, like in many high-income countries, a very strong alcohol industry means that most social interactions outside the home end up involving alcohol use, especially when they're mediated by another business. The increasingly concerning consequences of this in California are reflected in the numbers. Over 10,000 lives are lost annually to alcohol use. Alcohol use costs the state $35 billion. Binge drinking rates are soaring in the United States, and self-reported alcohol use disorder has increased by nearly 50% over the past 20 years. We know that the alcohol industry in California carries substantial clout. They've used direct democracy, aka the proposition system, among other lobbying and political tricks, to hamstring local and state governments' ability to raise funds to address these harms. In California, our alcohol and tax policies recoup only 10% of the economic losses caused by alcohol harm. And efforts to assess increased alcohol harm mitigation fees have been met by industry-backed propositions that made it prohibitively difficult to raise these taxes or any other source of funding to offset alcohol harm. It's important to note that the industry is not just doing this sort of instinctively. They're very proactively trying to prevent any ability to raise taxes on their products. They actually partnered up, Anheuser-Busch partnered up with the soda industry to kill the sugary beverage taxes in California that were a very popular public health measure. So it comes as no surprise then that in efforts to mitigate the harm from COVID-19, the economic benefit to big alcohol has taken precedent over the prevention of disease, both alcohol harm and actually prevention of coronavirus. So when we went to shutdown, the California Department of Alcoholic Beverage Control instituted a series of what we call regulatory reliefs, or you can just go ahead and call them deregulations, meant to facilitate the sales of alcohol. And I recognize that there is severe economic pressure facing small business owners and hospitality workers, but deregulation is short-sighted and threatens to perpetuate alcohol harm. And just as a side note, we're already seeing in other states that have deregulated efforts to make these deregulations permanent. But in particular, the real concerning ones in California is the facilitation of alcohol delivery and the normalization that alcohol is something that should be always consumed with a meal. And the basic fact that when you put alcohol on a menu next to normal takeout items, you are essentially advertising alcohol. You are increasing the advertising reach of the industry. So anyway, yeah, we're sending the tacit message that buying and consuming alcohol is not only normal, it is also a service to our fellow residents of the state. It is a service to the working class, is a service to hospitality workers. And just as another side note, if you actually look at how these reliefs work, the benefits that can be accrued by national and international mega retailers are actually much greater than those that can be accrued by just a local bar or corner store. So anyway, just going to talk quickly about intentionality. I think this is a buzzword that's come up in people who are looking to reduce the harm alcohol has in their lives. And it basically refers to being able to make a deliberate decision to drink a specific amount of alcohol only at a certain time. And we have a century of data that reflects that alcohol access restrictions essentially strengthen people's intentionality, that having to travel to go get alcohol actually reduces the amount of alcohol consumed. People just, if it's just not there, people just don't think, oh, I should have this. So this is being directly undermined by these delivery policies, and this completely aligns with the industry's intention to destroy intentionality and make alcohol something that people just consume without thought or effort. So when we talk about this, omnipresence of alcohol sales, the technical term we use is overconcentration. ABC defines overconcentration as an alcohol outlet in an area that is already severely impacted by crime or already has an exorbitant number of alcohol licensees in that little area. Study after study has shown that overconcentrated areas experience more violence, more property destruction and nuisance, more crime, more accidental injury, and more hospital admissions for alcohol-related causes. Overconcentration is already epidemic. Los Angeles Drug and Alcohol Policy Alliance put out a report showing that 80% of Los Angeles census tracts are overconcentrated. San Francisco is probably the most overconcentrated city in the state, so much so that we keep seeing San Francisco legislators come up to Sacramento to appeal for even more licenses to be issued to the city because they argue that a new restaurant can't even get an economic foothold unless they can sell alcohol. That just being a restaurant that just sells food is just not even a business model that works now. This is a vicious circle. We are stuck in it and we need to get out of it. The problem is instead we are giving every alcohol licensee access to every individual's home through delivery. This makes every single census tract overconcentrated, massively so. So it's tempting to say, well, people aren't driving as much, they're not driving to bars as much. Although you can also argue that we are trying to find ways to create entertainment zones and big public spaces for bars to sell in, which would in fact make people drive to them. But regardless, it is tempting to say that lockdown means, well, it's not going to affect people if they're not like out in bars all night. But we cannot forget heavy alcohol use is implicated in a number of domestic concerns, a number of mental health issues. Alcohol use disorder is associated with a 500% increase in risk of suicide. Alcohol is heavily implicated in domestic violence. It's heavily implicated in child abuse and child neglect. In Los Angeles, overconcentrated areas report over twice as many hospital admissions for alcohol-related injury. And during a time when every hospital bed is needed for COVID, and when any hospital admission has the risk of becoming a way to contract COVID, this is more than just a resource drain. This is a lethal threat. So heavy alcohol use has immediately affects your vulnerability to COVID as well. Reports are coming out of Italy. Italy was the first European country to suffer through a debilitating outbreak of coronavirus. And these reports suggest that alcohol increased risk, both behaviorally and physiologically, to the disease. So alcohol use compromises the immune system. That makes you more likely to contract the coronavirus. It makes the COVID symptoms more severe when you get them. It also causes systemic inflammation, and inflammation in the lungs is literally the major cause of death from COVID. Like the actual physiological response that kills you is through inflammation. More generally, intoxication makes it clearly harder for individuals to judge risk, to judge the risk around them, and to judge the risk they're posing. So they are more likely to be exposed to a carrier or to fail to protect themselves if they do not realize they are a carrier. So studies of alcohol harm under lockdown are preliminary at this point, but we're seeing strong indications that people who already drank recklessly are now increasing their the frequency of hazardous drinking behaviors. A preliminary study from RTI suggests that Western states in the US have been impacted much more strongly by increased alcohol use during COVID. And our own studies show that binge drinkers are more likely to be binge drinking even more frequently, that heavy drinkers are more likely to be binge drinking even more frequently. These are the hazardous behaviors that create injury, that create harm, and that ultimately can be controlled through access restrictions and overconcentration restrictions. Despite this, California is concentrating its efforts, is trying to pin its economic recovery on the alcohol industry. And this seems misguided at best, and it seems like a dereliction of duty to public health at worst. And just want to point out that Governor Newsom, I think he is doing everything he can during a very difficult time. Well, let me rephrase that. He is doing what he thinks right during a very, very difficult time, but it is important to note that his fortune is made in the alcohol industry. He has a track record when he was mayor of San Francisco of killing legislation that would reduce alcohol harm and increase funding for prevention and treatment in the city. I don't think this means he's deliberately trying to put California residents at risk, but I do believe that in the decision-making process, there is a bias towards the interests of the alcohol industry that we would ask that he actively try to push back against. So there are solutions here. Or at least there are ways to make things better. The first and most pressing one, and the one that big alcohol hates the most, is to raise alcohol taxes. Again, they've already passed propositions to make this incredibly difficult, but at a time when the country is suffering and the state is suffering, there has to be a way to raise the political will to do this. Alcohol taxes have a direct impact on consumption. As alcohol taxes go up, consumption goes down. Moreover, they are like a very small, it is hard to overstate how little we tax alcohol in the state and how much money can be raised by just a nominal increase. So according to our own tax calculator, an increase in excise tax of 10 cents per drink would generate $1.5 billion in revenue. This revenue can be used for prevention, for treatment. It can be used to treat COVID patients, and it can actually be used to help the residents of the state who are under severe stress from the economic shutdown, from the lockdown. Secondarily, we can find a silver lining in the economic devastation. All right, it is brutally difficult to strip an alcohol license from a small business owner during normal times. However, these are not normal times. We are seeing alcohol businesses failing through no fault of their own and through no aggressive action by the state. And that creates an absolutely unique opportunity that we will not see again to reduce overconcentration by taking licenses from failed businesses in overconcentrated areas and just retiring them, just take them out of circulation. We really cannot let this pass us by. Licenses once issued are extraordinarily difficult to retract, often require lawsuits, and this is just, here is just a dead license. Rather than reissue it under normal times, just take it out. So again, this is an extraordinarily difficult time for the state and for the country, but it's important to remember that harm is harm, injury is injury, violence is violence, and trauma is trauma, whether you're experiencing it from COVID or from alcohol harm. It is a false choice that we have to shirk our responsibility to one public health threat to deal with another. Real public health policy protects all the public from all the threats, not just the parts of the state that make money. Thank you very much.
Thank you, Carson. And with that, I also want to introduce our next speaker. We have Jamie Rich, who will be reading 3 youth statements from Courage, the Contra Costa Youth Health Coalition. Jamie Rich, the floor is yours.
Thank you, Veronica. I'm very happy to read these 3 statements. Unfortunately, they couldn't be here themselves. The first is from Eric, who is a senior. His statement starts, "I'm a part of Courage, the Contra Costa County Youth Health Coalition, a group of youth dedicated to spreading awareness and educating our fellow youth parents and politicians about the importance of addressing youth substance abuse and fighting for policies to create a lasting impact. We represent every corner of our community and strive to create a brighter future tomorrow, starting today. I bet everyone knows Donald Duck, that stubborn sailor who's always trying to be Mickey but can never pull it off. I'm not here to talk about Donald Duck, though. I'm here to talk about his 3 mischievous nephews, Huey, Dewey, and Louie. These 3 love getting into trouble whenever they can. In fact, once they even stacked up on top of each other to hide in a trench coat to be tall enough to get on a roller coaster. Now, why should that matter? Just like Huey, Dewey, and Louie, kids today are dressing up this time as senior citizens to buy alcohol. Teens across TikTok are participating in this challenge, and it's crucial now more than ever that ABC policies are still followed, and more importantly, our leaders address the issues that are driving teens at high rates to alcohol in the first place. We need lasting reforms that hinder this pattern from continuing through the pandemic and after it is passed. Thank you. The next statement is from AK, who is a freshman up here in Northern California. This cannot become a norm amongst teenagers to consume alcohol, especially during a global pandemic. Teenagers and the elderly mustn't harm themselves and must keep their bodies clean and strong. And lastly is a statement from Alexia, who is a senior up here too. Due to COVID and the lockdown, alcohol has become essential, not just to those over the age of 21. Truth is, when Governor Newsom turned his overall focus on COVID, he failed to protect other matters at hand. We all understand how much attention this situation should receive, but at what cost? Underage drinking has become so popular, it's ridiculous. I see it all the time because they post it. Individuals under legal age of drinking are able to purchase alcohol. Now, why is that? Some online alcohol purchases and deliveries do not require ID for these young adults who want to try something new, do not realize the harm in underage drinking, such as the negative effects on brain development. They're exposed to alcohol, it's all around us, and the temptation is everywhere. By not requiring ID, young adults have been failed by being able to get their hands on something they shouldn't, as well as being under an impression that less alcohol will do less harm. For example, a popular alcohol drink is White Claws. They have less alcohol in them than your regular Modelo, so why not try it? It won't do much anyway, right? Wrong. Alcohol is alcohol, and laws have failed those who are underage by not enforcing the law of requiring an ID for purchasing alcohol when it should be. Due to this, my generation has started early drinking, which will lead to damaging health in the near future, and it should be addressed. Alcohol distributors seem to not care about the age group taking it, but someone should. Thank you.
Thank you, Jamie, for reading those 3 youth statements. It is important that we remember how much damage the deregulation of alcohol is causing, specifically during a global pandemic. Next speaker I'm going to introduce is Richard Saldivar, Alcohol Justice Board Chair, Executive Director of the Wallace Memorials Project at Los Angeles. It's a base nonprofit organization dedicated to promoting wellness and preventing illness among Latino population affected by HIV and AIDS. Richard Saldivar, the floor is yours.
Thank you so much, Veronica, and good morning to all of you. Yes, I am Richard Zaldivar from the Wallace Memorials Project here in Los Angeles. And I'm here to talk, and first of all, I want to say that I'm really grateful that Governor Newsom has been so good on protecting the lives of people in California. And I know he gets a lot of heat, but we appreciate his leadership. But one of his policies is a failed policy, and that's a deregulation of alcohol during these most critical times. If people wanted to go out and have a drink, they can go to Costco or to the local liquor store and get the booze and take it back home. But delivery of alcohol, where we're not able, the state is not able to monitor any kind of restrictions or laws, is ridiculous, and it's contrary to public health. And we should have the interests of public health for our community, just as we're interested in preserving the health and welfare during this COVID-19 crisis. Alcohol is an essential threat to the LGBTQ community, especially the LGBTQ communities of color. We already know that the highest rates of COVID-19 is impacting Latinos, African Americans, and Asian Pacific Islanders. We know that for a fact. So do we need alcohol to be delivered to our house in this difficult time? Or do we need to have access to masks and to COVID testing and hospitalization? Substance use in the LGBTQ plus community needs to be a public health specifically for our Black and Brown and Asian community and Native American community. It's about high time that we get counted in when it comes to social justice. We continue to have a conversation about the social justice and the inequities of our political system and government system. Well, this is one of them, and we should be counted in that fight too. Alcohol has historically impacted our communities. It is an essential threat to the people in recovery. Many of you have read, if you've not written, stories about people who have been in recovery for a long time and they end up going out using drugs or alcohol. If you have the opportunity to walk into a Zoom AA meeting, many people will get up and talk about losing their friends who are out back on the streets, drinking and using. So I think the recovery community should be also counted in as Californians. There will be likely a generational impact in this deregulation. Drinking in isolation, go to cocktails. You know, I know it's difficult times for our community, for all of us, but do we really have to call and have liquor delivered to our doorstep? Do we have to go and buy drinks to go? I think we really need, if we're talking about the health and safety of Californians, we have to talk about pulling back and imposing our regulations back in the streets in California. And the LGBTQ communities are always out of the COVID recovery. We need to be included when we're talking about communities that are impacted by COVID-19. We are one huge community that's greatly impacted. Last night, we just hosted a conversation about the increase of meth use among LGBTQ community. During this time, I know it's difficult. People don't know how to cope, but we have to be supportive to our brothers and sisters during these difficult times. And I think as we move forward, we're asking the state of California, and we're asking you, Governor Newsom, to include the LGBTQ as part of a COVID recovery response. What are the difficulties that we face that are unique to our community that the state can adapt, and measures should be imposed that protect the health and wellness, not only for all of Californians, but also the LGBTQ community. I thank you, and I appreciate a response from the state of California. Thank you.
Thank you, Richard. Our next speaker is a youth who will speak on the local work to help mitigate some of the alcohol harms. Her name is Vanessa Ramirez Garcia. She is a rising senior at Dos Pueblos High School in Santa Barbara, California. She has been a youth leader with Future Leaders of America since her freshman year. She has worked on housing rights, equitable education, and strongly cares about the LGBTQ plus rights. Vanessa Ramirez Garcia, the floor is yours.
Hi, my name is Vanessa, as she said earlier, and I've noticed that during this pandemic, a lot more of the youth that I work with and that I try to help by doing community work and policy work have gotten a lot easier access to alcohol through, like somebody said earlier, delivery services and go to cocktails. And a lot of their parents don't really know about this. A council member that I talked with didn't really know that this was happening or that this was an issue until I brought it up in a meeting with him, and also with a coalition that I went with. And it's really tough to see all this going on and then the adults not really noticing that it's happening. Because I'm a teenager, I know how we think. We always find ways to get around things. We find loopholes. So I try to bring up these loopholes to try and help prevent what could be a really big issue. And right before the whole pandemic was going on, we were talking about putting a tax on alcohol to raise money to go back to our community, and also to hopefully drop alcohol intake. And then also we also wanted to have to stop the sale of alcohol at midnight instead of, I believe it was either 2 or 3 in the morning, due to quiet hours here in Santa Barbara being at midnight, I believe. Yeah, that's just some of the work that I've done, but it's really tough to see that youth are by themselves and really being isolated, and a lot of them have struggled with their families because a lot of them are Latino youth that I work with and that live in Santa Barbara, that for them alcohol has been a part of their life since they were born. Somebody that I used to work with would say during a kid's birthday, there would always be more alcohol than actual birthday presents. And that's something that always bugged me because I always noticed that growing up. There would be coolers just filled with alcohol, and that I'm really wanting to change that because it's not a great environment to grow up in, especially if you're young and your mind can be influenced at a young age.
Thank you, Vanessa. Thank you, and thank you for all the work that you're doing. You're definitely leading the way for youth to take action and create change in their communities. It is our part to take action, and we appreciate all the work that you're doing locally in your community to help reduce alcohol harms. With that, I'm going to go ahead and introduce our next speaker. We'll speak on ways to address overconcentration of alcohol. Our next speaker is Brenda Villanueva. She is the co-chair of the Los Angeles Alcohol, Drug, and Alcohol Policy Alliance, a Los Angeles County-wide group working to pass policy to reduce the impacts of alcohol and drugs in the lives of young people. As a program director for Pueblo Salud, she works to educate communities on the impacts of drugs and alcohol, and she is also a member of the LGBTQ+ caucus. The goal is to organize, amplify LGBTQ voices, to advocate for policies that protect our community. With that, Brenda Villanueva, the floor is yours.
All right, good morning. Like she said, my name is Brenda Villanueva, and I am a co-chair of the Los Angeles Drug and Alcohol Policy Alliance. Like she said, we're a group that advocates for the safe and healthy communities by reducing drug and alcohol-related harm through public awareness and policy change in Los Angeles. I'm here this morning to address some of the ways that communities in Los Angeles are being affected by deregulation and lack of consideration for pre-existing issues like overconcentration and alcohol-related harms across our communities that are largely populated by immigrants and people of color. Quite frankly, I'm perplexed by the fact that alcohol licensed businesses are deemed essential, as we have data that supports the harms related to alcohol consumption, and one being that frequent alcohol consumers are at a greater risk of being heavily impacted should they contract COVID-19. Since the stay-at-home order, studies show that there has been an increased consumption of alcohol overall, but it has heavily impacted those who are unemployed, are struggling economically, have children, and are living in areas that are highly concentrated with alcohol outlets. Here in Los Angeles, we pretty much have where each council district is over-concentrated by alcohol outlets by over 300%. And recently, there has been reports that have shown that domestic violence, child abuse, and neglect has increased, and it's kind of correlated to the increase of alcohol use, mostly affecting those areas that are heavily concentrated. Now, additionally, with the daily stresses and uncertainty associated with the outbreak and the economic collapse, the alcohol industry has capitalized on this by heavily promoting happy hour Zoom parties, happy hour to go and delivery services, and specials, and different consumption challenges via social media. Now, with this relaxation of laws, along with the heavy promotion, it has also opened the access and availability of alcohol to youth, because there is no way to verify ID. There's no process of verification. So that obviously opens the door for them. And with that being said, it's also kind of promoting gatherings. It's promoting pretty much all these little different parties which youth kind of are drawn to. And there's a complete disregard for social distancing with these mass gatherings, which also kind of exposes more people to the virus and increases not only alcohol use, but exposure. I would say that a great place to start is by having a COVID response that allocates resources and alcohol-related harms by retiring licenses as those that were not active before COVID or those that are not even or pretty much have gone out of business. Right here in Los Angeles, we have a very lack of local response. And I think that it is important that there should be statewide intervention and that there should be accountability brought to the issue. I would encourage the governor to, keep, working towards obviously the COVID response, but I think it's imperative that moving forward, you keep public health and safety in mind on all aspects as you make policy changes, and that you reconsider deregulating alcohol as it highly affects the quality of life of those communities already being adversely affected by the pandemic. Like one of my colleagues had stated, it's important that as we think of public health, we're not just thinking about, minimizing the spread of the virus, but also looking at all these different factors that affect our communities, and alcohol consumption is one of them. Thank you, and I highly recommend that you please give us a listen and take all of these recommendations into consideration.
Thank you, Brenda. With that, I want to also remind participants to also make sure that you're using the Q&A, submit questions, and if you want, you can make sure that you address it to a speaker, and we will go over those questions at the end of this press conference. With that, I want to introduce our last speaker of the day. This speaker will speak on the Department of Alcoholic Beverage Control and the need to establish a statewide standard alcohol policy. Gilbert Mora has a master's degree and is currently the co-chair of the California Alcohol Policy Alliance, CAPA, and he is a prevention coordinator for the Behavioral Health Services, Hollywood Family Recovery Center. BHS is a nonprofit community health care organization providing an integrating approach to mental health and substance use disorders and offers a comprehensive prevention services program. With that, Gilbert Mora, the floor is yours.
Good morning. As Veronica stated, my name is Gilbert Mora. I am the co-chair of the California Alcohol Policy Alliance. I'm here to discuss how California's Alcohol Beverage Control Department, also known as ABC, has chosen profits over public health through its deregulation of alcohol during the COVID pandemic. In a meeting with the California Alcohol Policy Alliance less than a month ago, ABC explicitly stated that, I quote, "Public safety and economic development is our first priority. However, is it not also their responsibility to protect the public health, especially in this time of COVID-19? We don't have any confirmation that ABC even consulted with the California Department of Public Health during the formulation of its COVID-19 regulatory relief standards. In fact, it is clear that there is no scientific basis behind the formulation of these standards. ABC's COVID-19 relief only intention was to bail out the alcohol industry, and it was done in a careless manner that put people's lives at risk and has contributed to the current spike in COVID-19 cases. We're also seeing an increase in domestic violence, alcohol abuse, and youth underage drinking due to the supposed regulatory relief. ABC, in theory, is primarily a law enforcement agency, but its regulatory actions and inactions would make one assume that they're in the business of alcohol promotion and economic development. ABC rarely denies alcohol license, and in fact has contributed to social, racial, and health inequities by allowing alcohol overconcentration in historically disadvantaged communities throughout California. These inequities are also contributing to the increase of COVID-19 cases in people of color because they're the essential workers on the front lines making this deregulation possible. They're hospitality workers, they're the delivery drivers, they're the people cleaning up in these restaurants. During this critical time when we are dealing with the health pandemic, ABC's complicity with the alcohol industry is costing lives. The California Alcohol Beverage Control Department needs to make the well-being of the people of California essential and not bail out big alcohol because they don't need it. Where is the science behind the public consumption of alcohol being essential? I mean, last check, no one can drink with their mask on. So basically, they're just promoting the spread of the COVID-19. We asked that Governor Newsom take a critical look at ABC and create a standard alcohol policy statewide based on science that allows us to integrate legitimate public health measures into California's COVID-19 response. Governor, please, please put people before profit. And thank you.
Thank you, Gilbert. And with that, thank you to all of our speakers. Thank you so much. With that, I'm going to now open it up for questions. Feel free to submit your questions in the Q&A box. And if you want to address it to a speaker, please go ahead and refer a name to the speaker. We can go ahead and answer those. We do have one question here is, it seems like that the isolation that youth feel is much greater than alcohol availability. How do we begin to address these issues? Would any of our speakers would like to answer this question? Let's have Brenda, would you be able to answer this question?
Yeah, go ahead and restate that, please.
This question says, it seems like the isolation that youth feel is greater than alcohol availability. How do we begin to address these issues?
I do agree that obviously right now, even among youth, I think the fact that there is a lack of, coping skills and just all this isolation going on, we have a generation that's very social, and a lot of it is actually done via social media. But with that being said, there are different ways that we can help our youth. Like, for example, the promotion of mental health services or other things, or whether it could be meditation methods and stuff that, they could have access to. And, now when you have youth isolated with the heavy promotion of alcohol, you're basically, we're having issues where we're basically having an industry saying that the best way to relax, the best way to distress is by consuming this substance, and it's not definitely helping the issue any further. And if anything, it could be correlated to more mental health disorders like substance use, depression, anxiety, which is not going to make the situation any better. And I think one of the ways to mitigate that is by providing other services and really, holding the industry accountable for their use of promotion, especially via social media where most of the youth are on, especially during this time that they have more time in their hands. So.
Thank you, Brenda. We do have another question. This question is for Carson. What is the governor doing about the current rates of alcohol-related harm in California? Carson?
That's a very broad question. Governor Newsom has not put together any coherent policy about alcohol. It is not a priority for this administration. It was not a priority for Jerry Brown's administration. There have been some bills to strengthen alcohol support and prevention services for younger drinkers, but that had not moved forward by the beginning of this year, and as you would expect, no legislation that is not related to COVID is really moving forward right now. We're hoping that in the wake of this, we'll resume some of those efforts to build a stronger support and prevention network in the state. Again, we alcohol justice certainly is going to continue to fight for increased alcohol excise taxes and increased services for people affected.
Thank you, Carson. We do have another question. This is for Gilbert. I want to applaud Gilbert on what he stated about alcohol beverage control and alcohol licenses. What can the community do to address ABC and the overconcentration of alcohol? Gilbert?
Thank you for that compliment. Yeah, I mean, we just need to put more pressure on ABC and send them direct messages saying that we don't like what the direction they're going in, and that we would wish that we had more quote unquote ways to address these alcohol licenses in a more meaningful way. At this point, most of these hearings that they have for these things happen at times that most, people are working. So us as public health, professionals and whatnot need to be the voice. So we need to be the ones attending these meetings, and we need to be bringing these statements from these people to the ABC and letting them know what's going on. And you know what? Look out for legislation that, will reform ABC hopefully in the future and support it and promote it. And later on the thing, we'll be giving you a a text that you can send that will go directly to the governor stating why we're having an issue with alcohol during this time of COVID.
Thank you, Gilbert. We do have another question. This question is for Vanessa. As a young person in Southern California, do you agree with the points that Northern California youth spoke to? Are they the same issues you see? Vanessa, the floor is yours.
Yeah, I see a lot of the same things that Jamie brought up about the youth up north, that especially when people are posting it on social media, I feel like that is an issue nationwide. Like this morning, I woke up to somebody's birthday. They turned 17, and in the background of the picture, I saw a few bottles of alcohol. So that was not the best way to wake up or to celebrate a birthday. And then one of their other friends congratulated on their birthday, and in the photo that they posted, they're like, don't drink too much. So that's definitely a big issue that's shown throughout social media.
Thank you, Vanessa. This question, there's another question. This question is for Carson. Doesn't alcohol hurt the immune system and should be avoided to protect against COVID-19? Carson?
Yes. If you feel you're at risk of contracting COVID, then absolutely, you should avoid drinking alcohol. It does suppress the immune system, and it does make the inflammatory response stronger, and that is, the inflammatory response is a major contributor to breathing problems. That's a really mild way to put it. The inflammatory response is what causes the pneumonia that kills you. So yes, absolutely. If you think you're at risk of exposure, it is very smart to avoid alcohol use.
Thank you, Carson. This question is for Gilbert. It seems that ABC only cares about enabling alcohol sales. What is their stated mission? Gilbert?
To be honest with you, I'm as confused as you, because they personally said to us in the meeting, their stated mission is the regulation of alcohol and the promotion of economic development. And I kind of went back and I looked and I'm like, where in their charter does it say that they're supposed to promote economic development? They're a law enforcement agency. That's like saying the CHP is in the business to make sure that restaurants can sell alcohol to drunk drivers. I mean, that doesn't, it seems counterintuitive for them to be an economic development when they're supposed to be regulating the alcohol industry, not enabling the alcohol industry.
Thank you, Gilbert. I will take 2 more questions and then we'll go ahead and close. Another question here is, and this question will be to Brenda. Why is there a disconnect from the precautionary messaging from the World Health Organization when it comes to alcohol?
I would like a little more is there more context for the question? Like, do they just mean overall, like the pandemic, or the connection between alcohol and?
Yeah, just the overall of the disconnection between just alcohol and how it's portrayed currently right now in relation to COVID-19.
I think right now is because for the most part, it seems like they're just trying to disconnect the two. Like, I feel like all efforts are just being kind of siloed. Like, everybody's just focusing on the fact that, oh, you know, we need to take care of this pandemic, but not really realizing that there's all these other contributing factors or these other issues that can only pretty much put people at risk. For example, like, there's been research that has shown that, you know, people that drink alcohol heavily are at greater risk of not being able to beat out the virus should they contract it because of weaker immune systems and just all these other issues. And I think that that's not really kind of being put out there. Like, the messaging is just kind of more like, stay safe, you know, social distance, but there's no other messaging like saying, like, you know, you might want to limit this. And not just that, but, you know, with isolation and everything going on, it's only gonna bring more mental health issues that I think are not being highlighted or addressed either. So I think it's just, you know, everybody's kind of putting their efforts on staying clean and staying safe, but disregarding that, you know, alcohol consumption also plays a major role, specifically in this moment.
Thank you, Brenda. And our last question will be towards to Richard. Richard, what do you think would be, how do we push back against the alcohol industry? Richard? Okay. We'll go ahead and I'll redirect the question to Gilbert. Did you want to close? This would be our last question before we close our closing remarks.
I mean, the biggest thing is that we need to push back against the alcohol industry in the sense that we need to educate ourselves more on how insidious their advertising is, how insidious their marketing is, and how they have a big strength in our government, how they can lobby and get things changed on a whim. So we need to educate our communities on how alcohol actually does harm them and their whole community as a whole, and get them to, you know, speak up and speak to their local legislators about why they feel alcohol needs to be reined in a little bit more, and complain about all the overconcentration and alcohol related, you know, nuisances that happen on a daily in their neighborhoods, and just keep being that squeaky wheel that legislators can't ignore. I mean, we did it with BLM, let's do it with alcohol. Be a squeaky wheel. Tell them we're tired, we're sick, we want our communities to be safe. Let's rein in alcohol because it only makes things worse.
Thank you, Gilbert. Thank you to all of our speakers. Thank you to all our participants for submitting your questions. With that, I'm going to give you my closing remarks, and we're going to give you our action. We have called upon Governor Newsom and the Department of Alcoholic Beverage Control in the past to recognize alcohol as a public health risk factor. And it is urgent now than ever for him to act on those calls. We are tired of social and health inequities that our communities face and continue to face during COVID-19. Our communities, our families demand public health and safety over economic gain. We demand that the Department of Alcoholic Beverage Control roll back the regulatory reliefs on alcohol licenses in the state of California. Address a disproportionate increase of alcohol harms by considering an increase of alcohol sales taxes and increasing alcohol licenses fees. Seek to retire old and unused alcohol licenses to address overconcentration in vulnerable communities. Implement a statewide standard alcohol policy regulation by integrating it into the COVID-19 response. These are call to actions. A call to actions. If you are on this call now, we ask you to text 313131. Well, it will prompt you and give you following steps to follow. This action will automatically go to Governor Newsom. This is a way to take immediate action. Again, we have a list of demands, and we ask Governor Newsom to take on those requests. Please text 313131 to take action now. And with that, thank you for all of our participants, for everybody that tuned in. Again, we will provide there is a media packet that is available online. There is a link that we will be sending out. We will be doing a follow-up email. You can also email our media contact, Mayra Jimenez, and her email is listed on the screen, to request additional information. If you would like to submit more questions to one of our speakers. For the media, if you would like to have an interview or ask one of our speakers more questions, feel free to contact our media contact, Mayra Jimenez. With that, thank you, and that concludes our press conference.